Before the coronavirus pandemic began, patients of other ailments in Uganda had a system that catered to their medical needs without delay. But the overwhelming force of the pandemic has changed all that, especially for cancer patients in the country who now struggle for treatment. Correspondent Hilary Yosiga reports.
Battling cancer, John Wani is suffering from bone cancer. He says access to care is still a challenge because of limited resources.
In the hospital, they just prescribe drugs and then tell you to go buy them from a pharmacy. I cannot afford a dose, so I buy half a dose when I get support from well-wishers.
Wani is just one cancer patient among many struggling with the effects of COVID-19. Rebecca Namsis is a breast cancer patient.
We are not working. Our businesses went under, so accessing healthcare is still a challenge for many of us cancer patients.
The most common cancers in Uganda include Kaposi sarcoma, prostate cancer, breast cancer, and cervical cancer. Health workers say COVID-19 restrictions have interrupted treatment plans for many cancer patients, and when treatment is not followed, patients get sicker. The Uganda government is now rolling out testing and treatment services closer to the community.
Yes, say, wait a minute, let us now go lower down. Let us create the regional centers.
Health workers say the number of people seeking care is also steadily rising.
The figure has gone up to 350 per 100,000 population. So as you can see, that is more than even threefold increase in just 10 years, which is a very, very big jump.
But as they bring services closer to the people, patients also want the cost of treatment subsidized.
But my plea is for the government to make a policy that this treatment should be put on a subsidized price or else to be free of charge.
But analysts say this may take time because Uganda, like many other countries, is battling a pandemic which has constrained her resources. That means patients like Wani will have to scrimp and save what little he has to access treatment.